Namaskar, dosto. Good evening. I am Purnima from Fertility Dost, and I welcome you all on this platform. We can say that Dost platform with a very interesting topic. आज हम और आप मिलके डिस्कस करेंगे हॉर्मोन्स के बारे में. We know that we have n number of hormones in female body. You can say that female reproductive system is being controlled by these hormones. बट एक्चुअल में क्या ये हार्मोन सच में इतने ज्यादा इम्पोर्टेंट है? एट टाइम्स दे जस्ट पे सम हाइड एंड सीक इन आवर बॉडी. कभी हमारा थायराइड बढ़ जाता है, कभी एएमएच कम हो जाता है. एट टाइम्स वी डू टॉक अबाउट प्रोलैक्टिन, एफएसएच, एलएच, ई2, मैनी हॉर्मोन्स. बट एक्चुअल में क्या हमें सही में नॉलेज है इन सब हॉर्मोन्स की? और क्या यही हार्मोन है? वी कैन से दैट दीज हार्मोन्स आर द कल्प्रिट्स फॉर आवर विजिट टू फर्टिलिटी स्पेशलिस्ट. क्या सच में ऐसा है? अगर ऐसा है तो लेट्स टॉक अबाउट दिस. लेट्स नो द फैक्ट अबाउट दीज ऑल हार्मोन्स, एंड is it really true that these hormones are impacting our fertility in a way also? So to discuss this topic, this whole thing, we have very senior doctor with us from Mumbai. And first of all, I want to thank UNS for arranging this informative session. And let's welcome our doctor, our guest on the main screen. Namaskar, Dr. Bandita. Welcome to Fertility Roast.
Namaste.
So, viewers, today we have Dr. Bandita Sinha with us, and she is from Mumbai. So, Mumbai people, आप please screen पे एकदम रहिएगा and please do ask your questions. And अगर इस session के बाद आपको लगता है कि you really need to visit Dr. Bandita, please do so. Dr. Bandita is IVF specialist from Women's World Mumbai. And when we talk about her expertise, so she has special expertise in treating critical cases, critical pregnancies, कहिए critical cases, and in particular tubal pregnancies, और जिनको हम ectopic pregnancies भी बोलते हैं. And she in the past also and right now also, she is handling many cases where she is doing successful surgeries for fibroid removals, laparoscopies, hysteroscopies, and lot more. And she has more than 12 years of experience as IVF fertility specialist. So Dr. Bandita, let's start the session. And we have this interesting topic: does hormonal imbalance affect the fertility? Is it really true?
See, when we come to the reproductive system of a female, or in fact, human being, the whole reproductive system works on the mechanism of hormones. That they are the guiding force which brings in all the changes as the child is born, and gradually they enter into puberty. Then comes the adolescence, adults, and then comes the reproductive age group, and gradually the age group ends and people enter into menopause and so on and so forth. So the whole life cycle, if you see, especially in a female, it is very vivid and magnificent, where you can see the changes of the hormone, the play of the hormone. We can see right from the puberty how the things are changing, and a young girl child develops in a proper young woman, and then the reproductive life when she becomes a mother, and then gradually the reproductive phase weans off and goes into the menopause. So there is a full circle which is played by the hormone. So without the hormones we cannot think of our life. Since I am a gynac, I will mainly focus on the gynac part, or the female reproductive system, and the hormonal play within our body. So the hormones which are there in our body, they brings the changes, that is how the reproductive system develops also. If a girl child is devoid of reproductive hormones, so definitely in the age of puberty itself there will be no development of the reproductive organs. There are certain cases where there is no proper development of the reproductive organs. Say the uterus is still like a infant kind of uterus, or the childlike uterus. When the girl grows up to 18, 20 years, she's still not having menses and all. So that means there is some kind of hormones which has not worked in that girl, and then she has not attained the sexual maturity. So, and similarly, when the sexual organs, the reproductive organs are getting matured with the help of these hormones. Similarly, the hormones play an immense role to bring do the ovulation, and ovulation is very important for the ovarian cycle to produce eggs, which is important part for the reproduction. Again, these hormones have a very essential role to prime the uterus. From priming the uterus, we means they uh, make the uterus ready to conceive. So everywhere we can see that the hormones are there, which are the very integral part. And once the lady gets pregnant, then also the hormones are necessary to continue the pregnancy. If the hormones are deficient, obviously the lady will not be able to. So in a whole, you can say कि it's a very integral part of our life. Without the hormones, we cannot just continue with our life. Not only with the reproduction, there are other endocrine system in our body which also produce many important hormones which are very very essential. So if we talk about reproduction, definitely I will say that the hormones have a very important role in our life per se for the fertility thing. If there is any imbalance in the hormonal, any kind of hormone which we are dealing, there is disturbance in the fertility. So we will talk today about how this is going to affect our fertility and what can be done, right?
So, Dr. Bandita, when we talk about or when we discuss about hormones, it's generally like females. So, what about males? Sorry. Do males also have these hormonal imbalance? And do this hormonal imbalance impact their fertility also?
Definitely, yes. When we talk about hormones in females, like gonads, if we talk about gonads, male and female gonads. Male gonad is testis and the female gonad is ovaries. Ovaries produce eggs, whereas the testis is responsible for production of sperms. Now, for a reproduction, we need sperms and eggs both, right? The
Right.
nature has provided us two different systems. So one side, from the female partner we get the eggs, for which is again a hormone dependent thing. Male produces sperms, which is again a hormone producing thing. Then if there is any disturbance in the male, they may not produce adequate amount of sperms. There can be difficulty in the spermatogenesis. There may be problem with the sperm motility. So there are multiple disorders which we see due to hormonal imbalance, due to certain other things what we see in female. Similarly, we see those problems in males as well who are planning for a fertility.
Okay, right. So, doctor, if we talk about these hormones, so what are the important hormones when, as a couple, we are proceeding towards our fertility treatment for both male and female?
See, both male and females, the most important things are we talk about follicle stimulating hormone, we talk about luteinizing hormone, we talk about thyroid stimulating TSH and prolactin. All these are the basic hormones which are linked to fertility. If there is any kind of imbalance in these hormones, definitely the spermatogenesis or the ovulation is going to be affected. And in female, we have another hormone which is known as anti-Mullerian hormone or the AMH, which has been in vogue nowadays. Earlier, last 15-20 years back, we were not having those lab tests which could detect AMH in females. Then in those days, it was very very difficult to identify कि how much fertility is left in this female. So today we are at least having a test which can tell us the fertility level of a female. Suppose a lady who is having a less AMH at the age of 30 years, definitely we will tell her ki please don't wait for another 4 years, you plan your pregnancy faster. Or a lady who is having more AMH at 31 or 32 years and she wants to wait for 2 more years, we can at least give them a guidance. See, acha, okay, you have a good AMH, you can wait for 1 more year. But a lady who is having less AMH, reduced AMH, I cannot say that you wait for 3 years. Even she is not mentally prepared, even there is a financial problem, then also I have to counsel her. Okay, look, your AMH is less. there will be very minimal chances of getting your own pregnancy with your own eggs if you wait for another 1 or 2 years. So it is better you get pregnant as till your AMH level is at least borderline, where you are going to produce some eggs and get a pregnancy, rather than later on just waiting and taking a donor egg to get a pregnant and going for other advanced treatment. So it is very very important, and nowadays it has become very easy for us, and even all females should also understand, because with education and lots of people are not liking to take a pregnancy in maybe late 20s or early 30s also. Most of the educated females, they want a pregnancy after 35 nowadays. But if you talk in our medical terms, 35-year is too old. In fact, we were taught that if a lady gets pregnant at the late the age of 35, we call it as an elderly primigravida. That means a mother who has conceived at an elderly age, and it goes into high risk pregnancy, because it comes with lots of complication, especially for the Indian woman, where our menopause is very very early as compared to the Western counterpart. Here we
Right.
see girls menstruating starting at the age of 8 years, 9 years, 10 years, the girl starts menstruating because of our hot and humid climate. Whereas in the Western world, the girls, they start menstruating at 16 years or 17 years. So they can continue their menses till 55 years also. Whereas in Indian scenario, we attain menopause at 46 years or 47 years. So our average age of menopause is 46 years. So we cannot play too much with the time. If we are not taking pregnancy in early 30s and we are waiting for late 30s, obviously after 35 years there is a sharp decline in the fertility of an Indian female, and it becomes very very difficult for them to conceive very easily. Most of them, they require additional treatment, maybe medical treatment sometimes, and the medical treatment does not work, and people are bound to go for an artificial reproductive techniques like IVF and all those treatments. And as we move towards in the age of 40, 41, 42, obviously there are more chances that the chances of natural pregnancy will be less, chances of IVF treatment will be more, and along with that comes all the medical complications as well. It's not only the pregnancy, as the body is aging. So a mother who is 31 years and a mother who is at 41 years makes a hell lot of difference, right? So we need to understand it's not only the reproductive thing. There is a whole lot of the changes happening inside the body also, which is changing as we are going old. So that is why this AMH helps us to identify ki how much time I am left with, how long I can wait. And if there is a thing, suppose somebody is not married, she is 30 years and she is not married, and she can do her AMH and see kilo my AMH, how much is my AMH, because I don't know when I'm going to get married. So there are techniques, we can freeze her eggs, we can keep her eggs, rather than after 5 years she gets her partner and then she finds that now the AMH has gone down, now her fertility has gone down. So these investigations in a way, they are guiding us also ki how I can plan my fertility, what should I do to preserve my fertility. So this is how we can utilize these lab investigations.
So, doctor, we usually mark 35 as a deadline. Like when we talk about age, when we talk about female fertility. So, is there any marker or deadline, or we can say that age for males also?
See, males till 50 years, they don't have much problem if a male is healthy and he is not having any comorbidity, especially if he's not having diabetes. Okay. And he's not on any kind of medication, no smoking, no other kind of drug abuse, tobacco, and all those stuff. Then 50 years is also okay for males, but that is not true for females. Okay. But if a male is having diabetes, somebody suppose 35-year-old having severe diabetes, uncontrolled diabetes, then too much of obesity, hypertension, tobacco use, smoking, very bad lifestyle, then the 35-year age group of male is also very, he may not have that good amount of sperms. So that is very important. Ki what is the lifestyle of the individual whom we are talking? If the lifestyle is very good, a male at 50 years, 55 years can also be fertile and can have children. But if the lifestyle is not good, even what we are seeing nowadays, we are coming across with more and more male infertility because of long
Right.
working hours, too much of stress, irregular eating habit, lack of exercises, obesity, smoking. So all these stuffs are causing fertility issues in males also at young age. 35 years, 30 years, we are coming across with males. We are having lots of health issues and lots of fertility issues. It's not only the females who are suffering.
Right. So, doctor, in your practice or in your clinic, what is the commonest hormone imbalance which you are seeing nowadays?
In one word, I can say it is PCOS, because it has become an epidemic in our country. So it was earlier, 20 years back, we used to see it was mainly a disorder of Western world, but now it has become so rampant in our country. Every alternate female or every two girls out of five girls, I can see that they are suffering from PCOS. PCOS is a condition where there is a plethora of symptoms. It's not that everybody will have a sonography which will show polycystic ovaries.
One.
It's not like that, because since this is an hormonal problem, this is a lifestyle problem. There is a spectrum of problem. There, in one spectrum, the lady may have, she may be obese, she may have lots of acne on her face, there will be irregular periods, there can be borderline diabetes in these patients. On other hand, we have patients who are look absolutely normal, they don't have any problem, but they are lean, but they have PCOS, there is a hormonal imbalance, they are not able to conceive. So both the things are there in the society. Even there is a lean PCOS, there is a obese PCOS. So the thing is that we have to identify which factor is affecting this particular female and causing PCOS. Everybody will not have a similar kind of presentation. Then obese person will have a different kind of PCOS with a different set of problem. And all the PCOS patient will not come with an irregular period or delayed period. Some of the females have absolutely normal period, but they have lots of facial hair, which we call medically hirsutism.
Right.
Hirsutism, because there are male hormones which are in abundance in the body. In these PCOS, what happens normally? There is an imbalance between the female hormone and the male hormones. We all have, even in our female body, there are some amount of male hormone and female hormones. Female hormones are in abundance and the male hormones are in minuscule. So as to balance it. Okay, so in case of PCOS like condition, the male hormones take an upper hand and the female hormone dips. So there is an imbalance between the male and the female hormones. So obviously, if the male hormones is dominating, so what it is going to do? It is going to first stop the period, because males do not menstruate. So androgens
Right.
are going to stop the periods. I am just explaining in a very layman's term so that everybody can understand. तो मेल हार्मोन ज्यादा होगा तो ऑब्वियसली पीरियड्स बंद हो जाएंगे. Secondly, facial hair will start coming up because males have facial hair. So that also is indication कि male hormone body में ज्यादा है. Second thing is that obesity will happen. Skin will become coarse because males का स्किन कोर्स रहता है, फीमेल the
One.
skin is very soft and thin. So whatever male like feature will start happening inside the female body, and that is why this is called a hormonal imbalance between the male and the female thing. So when we treat this patient, we have to balance this so that the androgen level goes down, the female hormone comes up, and it balances together, and the lady again starts ovulating. So this is how we tackle these problems. And it's a very important thing is that stress is very very important for any kind of hormonal imbalance, and especially when we are seeing PCOS in our day to day life. I can feel that late nights and too much of stress. The more you are awake in the late night, the more you have chances of hormonal imbalance. When we talk about an ovulation cycle, why this is happening? Because पेशेंट्स
True.
बोलते हैं कि बहुत काम है एंड लॉन्ग टाइम ऑफिस में जाता है, तो लेट नाइट तक लोग दे डू वर्क ऑन योर देयर लैपटॉप्स एंड ऑल. तो इफ यू आर अवेक लेट नाइट, अगर आप 9 o'clock के बाद आप डिजिटल मीडिया पे हैं, डिजिटल डिवाइसेस पे हैं, तो व्हाट विल हैपन, योर ब्रेन विल नॉट गो टू रेस्ट. Brain requires at least 1.5 hours to 2 hours to settle down to go into a sleep mode. So suppose if you stop the digital devices by 9 o'clock or 10 o'clock, so it will take minimum 2 hours to settle down, and then only the sleep will be induced. Now, if you are
Right.
working till 12 o'clock or 1 o'clock, so obviously that sleep cycle gets
Right.
disturbed. And when we talk about these FSH, LH hormones, they are released from brain. This is not released from ovary. Okay, this is another
Right.
point. Released from our pituitary gland, which is inside the brain. So now, if I am awake till midnight, the brain will never get a signal that you have to go to sleep. It will never release those hormones which are essential for ovulation and the sperm production. So
Right.
automatically, after some times, the brain will stop producing those hormones adequately. So brain and the ovary, there will be a disconnect. The brain will not produce proper hormones, the ovary will not get a signal. So there will be disconnect between the
Brain
center
and
and the peripheral organ. And that is how the stress and late night initiates hormonal imbalance. So obviously, if the brain and the ovary get disconnected, the ovary will work on their own terms. उनको जब मर्जी होगा वो पीरियड आएंगे, जब मर्जी होगा जो भी करेंगे, देन ब्रेन विल नॉट बॉदर अबाउट इट. सो क्या हो गया, हेड ऑफिस से डिस्कनेक्शन हो गया. So that is important. The people should understand. When we tell them ki please avoid, if you are trying to take a pregnancy, change your lifestyle first, because medicines are not going to create any miracle. You have to create the miracle, because in your body is a miraculous thing which can respond to any kind of change. So first talk about lifestyle changes. पहले आप 9 o'clock digital devices बंद करो. 10:30 to 11 o'clock go to bed, so that by 12 o'clock 12:30 के बीच में your fertility hormone starts coming up. And once those fertility hormones will start coming up, obviously आपके ovaries will start functioning properly, they will start ovulating. Then there will be less chances that you will not ovulate or you will develop a PCOS. So this is the main thing, how we can change or control the hormonal imbalance. Otherwise, every second person, whether it is a male or a female, they are suffering from some kind of hormonal issues.
right, right. And this is really important because at times we just chant about these things. I have to change my lifestyle. I have to change my sleeping pattern. I have to change my eating habits. But हम करते कितना है, ये यहीं से
Exactly.
पता चलता है कि as Dr. Bandita just said that we are having a huge number of PCOS females. So please take care of your lifestyles because this is the first step towards your conception or motherhood. Doctor, we have queries related to thyroid hormones, and I don't know whether it is a misconception or it's a fact that the number of people having their THS level high are very common nowadays. And when we talk about females, तो यूजुअली उनको लगता है कि एक छोटी टैबलेट जो मुझे मेरा थायराइड कंट्रोल करने के लिए खानी है वो सारी उम्र खानी पड़ेगी, तो बेटर है मैं शुरू ही नहीं करती. सो व्हाट आर योर सजेशंस ऑन दिस पार्ट?
See, thyroid is a very, very important hormone for our life, because it is a hormone which controls our metabolism. If we keep the reproduction apart, if we are not planning for pregnancy, even if we are Then also, without the thyroid hormone, we are not going to be alive. Thyroid is
Okay.
basically whatever we are eating, whatever we are doing, where we do we get the energy. The thyroid hormone, which is there in our neck, okay, so it stimulates the metabolism. So sometimes people say कि हम इतना एक्सरसाइज करते हैं और मेरा वेट तो घटता ही नहीं. Why?
Right, right.
Because your thyroid is not working, your thyroid is sleeping. आप कितनी मर्जी एक्सरसाइज कर लो, कितना अच्छा खाना खा लो, इफ योर थायराइड इज स्लीपिंग यू विल नॉट लूज वेट. So what to do now? So thyroid, we have to investigate if there is a thyroid problem. If my thyroid is not working, that means it is a hypothyroid, right? And in that condition, obviously my metabolism will be slow. And in that condition, and we have seen that thyroid and PCOS go side by side. Most of the patients who have PCOS, they have a thyroid problem, and thyroid people also, we have seen they have PCOS. So there is some kind of link between these endocrine organs. And India being a geographical area where we have more thyroid cases, and females, Indian
Right.
women, are more prone to thyroid problem. That we have to accept कि इंडिया में थायराइड प्रॉब्लम ज्यादा होता है. So that is
Got
why
it.
those iodized salt and all those stuff has come up, and due to which बहुत सारी चीजें कम हो गई है. But with our modern day eating habits, where we are taking lots of junk and other stuffs, there's lots of
Mhm.
deficiencies happening in our body. And again, there is less amount of physical activity, and delayed absence of breakfast. Suppose somebody is getting up in the morning, not taking breakfast, going to school, going to office and all. So once you get up in the morning, your thyroid needs food to pep it up, to start the activity. So if I am not giving food in half an hour to 45 minutes after I wake up in the morning, that
Mhm.
thyroid will never wake up, it will be sleeping. 12 o'clock,
Oh.
if I take a brunch, or 1 o'clock, I take a very good meal, thyroid will not do
Mhm.
anything. It will not burn whatever I have taken. So what will happen? Those food will go and get stuck, and then it will lead to obesity. That is why people get obese. They skip breakfast, they go to bed late night, and in the morning, no physical activity, no breakfast, and they go to office. So if we are doing this thing right from the childhood, right from the school, college, office, so over the period, by the time you reach 25 years, thyroid to hoga hi, because we are
Right.
not taking good care of the thyroid. Thyroid ke liye you have to get up early in the morning. You have to take breakfast. You cannot skip breakfast. You have to give something, otherwise your metabolism will not never initiate. So it's very very important. And thyroid is also very important for pregnancy. If there is imbalance in the thyroid hormone, be it hypothyroid or hyperthyroid, some
Right.
people have hyperthyroid also, but hypothyroid is more common, where the levels of thyroid hormone, thyroid gland is not functioning. So the brain produces lot amount of thyroid stimulating hormone. So if we are not balancing this, so there are chances that the lady will have miscarriages. There are Thyroid is very important for the mental growth of the baby. There can be mental retardation if the thyroid is very high and the lady is not taking medicine. So there will be mental retardation. There will be growth problem of that baby. Maybe उसका height नहीं बढ़ेगा आगे चल के, उसकी growth नहीं होगी आगे चल के. So it is very important. And many times thyroid, we when pregnancy happen and we do the first blood investigation, there we pick up कि the thyroid hormone is high. So we immediately start medication, because बहुत सारे पेशेंट्स को मालूम नहीं होता है कि उनको थायराइड है, और या
Right.
वो बॉर्डर लाइन में रहा होगा. इफ इट इज अ बॉर्डर लाइन, ऑब्वियसली people don't take medicines, and we also do not prescribe medicines. We, but then अगर प्रेगनेंसी हो गई और सडनली फर्स्ट ट्राइमेस्टर में हमें लगा कि थायराइड हैज गॉन अप, so we usually give medicines, but that doesn't mean कि आपको लाइफ लॉन्ग लेनी है. मेनी टाइम्स प्रेगनेंसी के बाद धीरे धीरे थायराइड नॉर्मल भी आ जाता है, बट देन इमीडिएटली इंस्टेंटली बंद नहीं करना है. वी कैन टेपर द डोज, वी कैन मॉनिटर इट, एंड ग्रेजुअली जब हमें आफ्टर few months लगेगा कि नहीं, now the body is balancing on its own, they do not need any supplement, then we can stop. But not taking thyroid hormone And planning a pregnancy or even not planning a pregnancy is going to be more problematic later on, because it will cause high cholesterol, it will cause heart disease. So taking a small tablet which can keep you safe throughout the life is much better than not taking anything and having a cardiac illness after 10 years.
Right, right, right. So each and every hormone is really important, and we believe that proper investigation is important factor when you are dealing with your fertility issues. And one important thing over here is please don't delay your visit to the doctor. Always plan your visit accordingly, because इट्स अ ह्यूमन नेचर. हमें लगता है कि अब सब कुछ ठीक है तो रहने देते हैं, थोड़े दिन बाद फिर देखेंगे, एंड सिचुएशन इट जस्ट tend to get bad with each month. And the time will, now the timeline will be like 35. So you really need to hurry up your, you really need to brush up your tactics to deal with your fertility issues. Dr. Bandina, in the end of this, we can say that हार्मोन ज़रूरी है मेल और फीमेल दोनों के लिए, और ये दोनों की फर्टिलिटी को इम्पैक्ट करते हैं. सो व्हाट यू सजेस्ट फॉर आवर व्यूअर्स कि कितना रेगुलर चेक होना चाहिए इन हार्मोन्स का अगर वो प्रेगनेंसी प्लान कर रहे हैं?
The first thing, if you are planning a pregnancy, सबसे पहले है कि you have to go for a pre-conception counseling. So it is very
ओके.
important कि suppose now I am ready to take a pregnancy and planning a family. तो सबसे important है you go to a doctor, your gynec, or with whoever you are comfortable. It's not required कि आपको सीधा fertility expert के ही पास जाना है, ऐसा नहीं भी कर सकते हैं. आप एक रेगुलर नॉर्मल किसी भी गायनेक के पास जा सकते हो. वहां पे आप यू कैन टेक अ प्री कंसेप्शन. व्हाट इज प्री कंसेप्शन काउंसलिंग? प्री कंसेप्शन काउंसलिंग मीन्स what all things are important before taking a pregnancy. Okay, before you
ओके.
conceive, what all things are important, what regarding that will be regarding all the investigations, regarding your all history, because the doctor should know all the history of yours. There are very many patients उनकी family history रहती है. There are certain disorders which runs in family, तो वो बेबी को इफेक्ट हो सकता है, तो उसके लिए अलग जेनेटिक टेस्ट होते हैं. देन देर आर सर्टेन हेरिडिटरी डिसऑर्डर्स, सर्टेन लाइक डायबिटीज एंड ऑल. उनकी हिस्ट्री जानना बहुत जरूरी. बहुत टाइम पेशेंट ये सोचते हैं मुझे नहीं है तो क्या जरूरत है ये सब करने का. इट्स नॉट लाइक दैट. अगर पेरेंट्स को डायबिटीज है तो हो सकता है आपको जेस्टेशनल डायबिटीज हो. यू बिकम
राइट.
डायबिटिक ड्यूरिंग प्रेगनेंसी, सो देन व्हाट विल यू डू? तो ये सारी जो हिस्ट्री होती है ना, इट इज वेरी इंपॉर्टेंट. प्री कंसेप्शन काउंसलिंग में हम लोग नॉर्मली सारे हिस्ट्री लेते हैं पेशेंट्स के, पूरी फैमिली हिस्ट्री, वेदर देर इज एनी abnormal child born in the family, whether there is any mental retardation happened in the family. अगर पेशेंट को कभी मिसकैरेज हुआ है, स्पॉन्टेनियस मिसकैरेज हुआ है, या कौन से ट्राइमेस्टर में मिसकैरेज हुआ है, देन अगेन वी विल फाइंड आउट. अगर कुछ इन्फेक्शन ऐसा है which can create a problem for the pregnancy, या repeated miscarriage हो रहा है, तो there may be some kind of infection in the reproductive tract or some kind of infection in the blood stream. वो हमें पहले ठीक करना है. बहुत टाइम पे बहुत सारे ऑटो इम्यून डिसऑर्डर्स रहते हैं, पेशेंट को मालूम नहीं रहता है पहले से, and they keep
राइट.
on miscarrying. दो तीन we at times we see 8 9 10 miscarriages. Patient कंसीव कर रहे एंड मिसकैरेज हो रही है, कंसीव कर रहे, but they are not taking any consultation regarding this ki why it is you are not carrying it properly, what is the problem. So there are many autoimmune disorders which can lead to recurrent pregnancy loss. तो ये प्री कंसेप्शन काउंसलिंग में ये सारी चीजों की काउंसलिंग होती है. And then we decide according to the patient history, both partner male and female both का हिस्ट्री लेते हैं. देन जनरल हेल्थ ऑफ मेल एंड फीमेल दोनों पार्टनर्स के हेल्थ चेकअप्स होते हैं, एंड वी वी गिव देम अ सर्टेन सेट ऑफ इन्वेस्टिगेशंस जिसमें फर्टिलिटी टेस्ट भी रहते हैं. तो एट रैंडमली एनीबडी शुड नॉट गो एंड गेट द FSH, LH and prolactin test done. That doesn't make any sense. So first you meet the doctor. After meeting the doctor, according to their history, हो सकता है आपको एक आधी टेस्ट ज्यादा भी लग सकता है, और
राइट.
some tests may not be required for you. तो ये हम रैंडमली जाकर के पैथोलॉजी लैब में वॉट एवर सेट ऑफ इन्वेस्टिगेशन है सारा कराने की ज़रूरत नहीं है. And after that we do a physical test checkup for the female. Then comes the sonography, and that according, if everything comes out to be normal, patient's AMH is good and there is no significant family history, patient is healthy, and age is also not too much, in that condition we advise ki theek hai, now you go and plan for another 3 months or 6 months, try on your own. If things are not happening within 3 to 6 months, then after 6 months you can come back, then we will reevaluate you, we can go for some other higher investigation. So it's like a step by step thing, where we can at every step, if you are in connected with the doctor, you can get a proper guideline कि ये टेस्ट हो गए, इसके बाद ये करना है, इसके बाद ये करना है. And most of the time I personally feel that with the preconception counseling, and then we give them a dietary consultation also, a lifestyle change consultation also, so that if they follow it for another 3 to 6 months, many of them they conceive on their own, they don't need any other further treatment, and directly they can go continue with their pregnancy. And also it is important to start all the prenatal vitamins. Nowadays the vitamin D level is very very less in most of the individuals, so if there somebody is planning a pregnancy, vitamin D is less, again it causes a fertility problem. So we need to see that whether the patient is taking vitamin D or not, patient is taking folic acid or not. So there are some prenatal vitamins which we usually prescribe and advise people to start before they plan a pregnancy, at least 3 to 6 months before planning a pregnancy. And sometimes while we are doing this preconception counseling, we sometimes come across with some kind of problem in the uterus or the ovaries which were earlier not detected. So if we
Right.
detect it early, we can treat it also, no? I have some patients, when they were planning for a pregnancy, suddenly we saw there is a ovarian tumor. 31-year-old planning for a pregnancy got an ovarian tumor and she did not have any symptom. So we
Right.
just picked it up when we do a routine checkup and all those stuff, and then we later on find out that it was something difficult. I mean, not a very good thing to have in the body. Then we operated and she was saved. So there are many surprises also nowadays we are getting. It is not nothing like if you are 31 or 33. Those things will not happen. Anything is happening at any age, at this point of time, with this kind of age. So it is very important, especially when we are planning to take a pregnancy. Pregnancy itself creates lots of burden to the body. So if my body
Right.
is optimal, so before you enter into a pregnancy, both the partners, if they are in optimum health, so obviously the outcome will be very good, and we can avoid any high risk pregnancy. There will be
Right.
smooth sailing, right? But if we are not taking care before pregnancy, and suddenly if somebody is pregnant, then miracle is not going to happen. We cannot do something suddenly when the lady is pregnant. If she is diabetic, if she is PCOS, whatever changes will has to happen, it will happen. So it is important that people should understand now, and they should consult a doctor before they are planning a pregnancy, so that we
Right.
can give them a proper direction how to go ahead and how to do all these tests.
So, if you are thinking about planning your family or you are thinking about adding new member in your family, please do preconceptional counseling, as just doctor mentioned. Don't hesitate to seek advice at any point of your journey. This is really important to take a right advice, because ultimately आपकी प्रेगनेंसी, आपका मदरहुड, आपका पेरेंटहुड ही इफेक्ट होगा. सो वी ऑलवेज एडवाइज यू टू हैव हेल्दी लाइफ. लाइफस्टाइल चेंज कीजिए. हॉर्मोन्स के बारे में थोड़ा बहुत जानना बहुत ज़रूरी है. Do keep regular checks on your hormonal values, and yes, all the best for your future parenthood journey. And thank you, Dr. Bandita. Thank you so much for joining today for this wonderful session. हॉर्मोन्स हमें पता था बहुत ज़रूरी है, पर आज पता चला कि सच में ये बहुत ज़रूरी है. थैंक यू.
Thank you so much. Thank you.